Hello everyone. Today we'll discuss about the ulnar bone. Now first of all you should know that the ulnar bone is actually the medial bone of the forearm while the lateral bone is the radius bone. Okay. Now first of all the very important thing, side determination of this particular ulnar bone. Now we remember the upper end of the ulnar bone is actually having a hook-like structure facing in the forward direction. Okay, concavity in the forward direction. While the lateral border of this particular ulnar bone is the sharpest border. So whenever you hold the particular ulna, make sure that the lateral border of this ulnar bone should be the sharpest one, and it will be easier for you to identify the particular which headed ulnar bone is actually present in your viva. Now also remember that the radius bone is actually having the medial border as the sharpest border. Okay, and the ulna is actually having the lateral border, the sharpest border, and these two borders, that means the lateral border of the ulnar bone and the medial border of the radius bone, actually joins together by the help of the interosseous membrane. Also remember the pointed styloid process of this particular ulnar bone lies posteromedially to the rounded head of the ulna at its lower end. So remember, I told you before also that this particular ulnar bone is actually having its head at the lower end, while the radius bone, the head is actually at the upper end, but the ulna there is head present at the lower end. Okay. So by this all we can say that the present bone on the screen is actually the left-handed ulnar bone. Now the very important features of the ulnar bone. Now first of all the upper end. Now over here as you can see in the upper end we have basically four important structures. That is first of all the Olecranon process and the Coronoid process and two notches, Trochlear and the Radial notch. Now first of all the Olecranon process. Now this process basically projects upwards from the shaft as you can see, and it has basically five surfaces, that is superior, anterior, posterior, medial and the lateral surfaces. Now first of all the anterior surface. The anterior surface basically articular and forms the upper part of the trochlear notch. Okay. Now the posterior surface forms a triangular subcutaneous area which is separated from the skin by a bursa. Now this posterior surface inferiorly is continuous with the posterior border as you can see over here. The posterior surface of this particular Olecranon process is actually inferiorly continuous with the posterior border of the shaft of the ulna, and the upper part of this particular posterior surface of this particular Olecranon process forms the point of the elbow joint. Also remember the inferior part forms the as you continue with the posterior border of the shaft of the ulna, while the upper part forms the point of the elbow. Okay. Now next is about the medial surface. Now the medial surface of this particular Olecranon process is continuous inferiorly with the medial surface of the shaft. The lateral surface is smooth and continuous as posterior surface of shaft, and the superior surface is in its posterior part shows a roughened area. Okay. Now next is about the Coronoid process. Now this process basically its name is Coronoid process because in the Greek this word actually means the crow's beak, and the crow's beak actually looks somewhat like the Coronoid process over here. So that's why its name is like this. Now this Coronoid process projects forward from the shaft just below the Olecranon process and has basically four surfaces. Remember that the superior, anterior, medial and the lateral. So first of all the superior surface forms the lower part of the trochlear notch. The anterior surface is triangular and its lower corner forms the ulnar tuberosity. Okay, its lower corner, lower part actually forms the ulnar tuberosity, while the upper part of the lateral surface is actually marked by the radial notch for the head of the radius and the annual ligament of the particular radius and the ulnar bone. Okay, is basically attached to the anterior and the posterior margin of this particular this particular notch. That means the radial notch of this particular ulnar bone. And the lower part of the lateral surface forms a depressed area to accommodate the radial tuberosity. And remember, this area is limited behind by a ridge known as the supinator crest. So here remember very important thing is that just remember that at the lateral surface we have one radial notch. Okay, for the accommodation of the particular head of the radius, and over here at the lower part of over here we have one depressed area at the lateral surface for the accommodation of the radial tuberosity of the radius bone. and this particular depressed area is limited behind by a ridge known as the supine intercrest. Now, the medial surface will be continuous with the medial surface of the shaft. Simple. The next is the trochlear notch. The trochlear notch is basically forming an articular surface that articulates with the trochlea of the humerus bone to form the elbow joint. Simple. And also the radial notch, of course the name says radial notch. So this basically articulates with the head of the radius to form the superior radio-ulnar joint. Now next is about the shaft of the ulna bone. Now the shaft is basically 3 borders and 3 surfaces. First of all, the borders. Now the interosseous border or the lateral border, anterior border and the posterior border. So first of all, the lateral or the interosseous border. Now this border is the sharpest one told you before only, and in its especially sharpest at its middle to 4th part. Remember, this particular lateral border superiorly is continuous with the supine intercrest, and inferiorly it can be traced to the lateral side of the head of the ulnar bone. The anterior border is basically thicker and rounded and begins above on the medial side of the ulnar tuberosity and passes backward in its lower 1/3 area and terminates at the medial side of the styloid process, while its posterior border is basically subcutaneous and it begins above at the apex of the triangular subcutaneous area, basically at the back of the Olecranon process, and terminates at the base of the styloid process. Now surfaces of the shaft of the ulnar bone. We have basically 3 important surfaces. There is the anterior surface, medial surface and the posterior surface. The anterior surface basically lies between the anterior and the interosseous border, and basically a nutrient foramen is seen on the upper part of this anterior surface. And remember, it will be directed upwards only. The nutrient artery is derived from the anterior interosseous artery, while the medial surface lies between the anterior and the posterior borders, while the posterior surface lies between the anterior and the interosseous border. And remember, the posterior surface is subdivided into 3 areas by 2 lines. Okay, over here an oblique line divides its divided into upper and the lower parts, while the lower part is further divided by a vertical line into a medial and the lateral part. So remember, over here oblique line basically divides this particular posterior surface of the ulna into 2 parts, that is the upper and the lower part, while the lower part is further divided into further 2 parts by the vertical line into a medial and the lateral part. So of course we can say that this particular posterior surface is divided into 3 areas by 2 lines. There is the oblique line and the vertical line. Now next about the lower end of the ulnar bone. Now the lower end is actually made up of the head and the styloid process. Head and styloid process. Now first of all, the head basically articulates with the ulnar notch of the radius bone to form the inferior radio-ulnar joint. And if you remember, previously I told you that the radial notch on the ulna at the superior against the upper end of the ulnar bone actually articulates with the head of the radius to form the superior radio-ulnar joint, while over here the lower end, the head of the ulnar bone actually articulates with the ulnar notch of the radius bone to form the inferior radio-ulnar joint. Simple. Okay. Now over here, remember, it is basically separated from the wrist joint by the articular disc, and one ulnar artery and a nerve lies on the anterior aspect of the head of the ulna. Very important. Ulnar artery and nerve lies on the anterior aspect of the head of the ulnar bone. Now about the styloid process. Now remember, the styloid process basically projects downwards from the posteromedial side of the lower end of the ulnar bone, and remember, posteriorly between the head and the styloid process there exists a groove for the tendon of the extensor carpi ulnaris. Okay, now next are the attachments of the ulnar bone. Now here remember, the triceps brachii is basically inserted into the rough posterior part of the superior surface of the Olecranon process, and over here the anterior part of this particular surface is covered by the bursa. Over here also remember the brachialis muscle. The brachialis muscle is actually inserted into the anterior surface of the coronoid process, including the tuberosity of the ulnar bone. The supine muscle basically arises from the supine crest and from the triangular area in front of the crest. The ulnar head of the flexure geodorum superficialis arises from a tubercle at the upper end of the medial margin of the coronoid process. The ulnar head of the pronateres arises from the medial margin of the coronoid process. Now next is the flexure deuterum profundus. Now this FDP basically arises from three main areas from the particular ulnar bone. That is firstly from the medial surface of the two processes, that is the Coronoid process and the Olecranon process. Also from the upper 3/4 of the anterior and the medial surface of the shaft of the ulnar bone. And very important, also from the posterior border of the shaft of the ulnar bone. Okay, through an aponeurosis, which gives origin to two further muscles, that is the flexure carpi ulnaris and the extensor carpi ulnaris. So by this we can say that FDP is basically originating from the particular posterior border shaft of the ulnar bone, and also from here only two further muscles, that is the flexure carpi ulnaris and the extensor carpi ulnaris also originates. Okay, and apart from the posterior border of the shaft, the flexure carpi ulnaris also originates, or we can say arises, from the medial side of the Olecranon process. Okay, next is about the quadratus muscle. Now this muscle basically takes origin from the oblique ridge on the lower part of the anterior surface of the shaft of the ulna. Now next is the Anconeus muscle, basically inserts into the lateral aspect of the Olecranon process and the upper 1/4 of the posterior surface of the shaft. The lateral part of the posterior surface basically gives origin from above downwards to, remember, three muscles, that is the abductor pollicis longus, extensor pollicis longus and the extensor indicis. Remember, from the lateral part of the posterior surface, remember there is origin of three important muscle from above downward, that is the abductor pollicis longus, extensor pollicis longus and the extensor indicis. Okay, now next is about the interosseous membrane. We all know, attached at the interosseous border of the particular ulnar bone. Now next very important topic, that is the applied aspect of the ulnar bone. Now first of all, the shaft of the ulna may fracture either alone or along with the radius bone, and the cross union between the radius and the ulna must be prevented to preserve the pronation and the supination of the hand. Now next is about the dislocation of the elbow joint, very common. Now this dislocation basically produced by a fall on the outstretched hand with the elbow slightly flexed. Okay, and the Olecranon process over here shift posteriorly and the elbow is fixed in its slight flexion position. Okay, now next is the fracture of the Olecranon process. Now over here the fracture of this particular Olecranon process is common and is caused by a fall on the point of the elbow. Whenever you fall at the point of the elbow, this particular Olecranon process actually gets fractured. And now next is the Madelung's deformity. Now in the Madelung's deformity, there is dorsal subluxation, which is the displacement of the lower end of the ulna due to the retarded growth of the lower end of the radius bone. So this is all about the ulnar bone. I hope you understood well.